Hi everyone, welcome back to my channel after a very long time. I'm Dr. Somlina. I'm a final year MD Radiology resident at a government medical college in Kolkata, and today my video is essentially about giving you people, those who are NEET PG aspirants, a strategy from my side for these last 7 days of NEET PG. Now, very two important things that I would like to tell you before starting this video. Number one, if you already have a plan and you are confident about it and you know and are very sure how you're going to go about in these last 7 days, I would not want you to watch this video and waste your time. And number two, if you have seen my previous videos, you know I'm not a fan of studying the same subject the entire day, and hence the strategy which I will be about to provide will mix and match different topics from different subjects, which I thought would be a very high yield topic in case you have nothing planned for the last 7 days. So let's move into our video. So I will be showing you the screen of my tab from now on, okay? So look down into my screen that I'm about to show now. Here I have given you certain mix and match of topics from different subjects, which I thought would be good if you would brush up just few days before the final examination. The last day before the examination has been denoted as day 7, and if you calculate from backwards, 7 days before is day 1. So for day 1 I have kept 3 subjects: microbiology, PSM and surgery. In microbiology, I feel that certain small topics like immunology, like virus, like fungi and general bacteriology, these things will give you a overall overview of the entire things. So certain questions you will be able to make if you know the general things. So fungus is a very small chapter, you can easily complete it. Virus is also a small chapter. Immunology itself is very big, but if you think about how much is needed for NEET PG, it is not that much big. So yes, you can complete these things. And one more thing is general bacteriology, I would ask you to complete. So if you are done with general bacteriology, many questions you will be able to solve even if you do not study each of the bacteria separately, and we all know how bacteria is important. So this is done. Next, in PSM, you should be revising the important vaccination schedules, especially the NIS. And another chapter I would advise you to please give a read is the statistics chapter. Okay, so these are certain chapters which you will not be able to make something up of your own. These are very factual and you have to write whatever is there in the book and whatever is there according to the latest updates. So I would suggest you to brush up these things. Next, in surgery, I would like you to study the trauma portion because it's very important, and trauma part is something that you should be knowing. If the question asked is very hard and you're not able to answer it, it is not much to worry about, because difficult questions many people are not able to answer, and if you are able to answer, your mark will soar high because many people are not going to answer it correctly. But what you cannot afford is, you cannot afford to mark something very easy, very obvious wrong. If you mark such a question wrong, your rank will come down a great deal. Okay, so trauma in surgery is something that you should be knowing very well as a doctor, because as interns you are often subjected to these patients who arrive at the ER with RTA, and you must be knowing what to be done after what, the protocols, what need to be done next, the investigation, the next best investigations, the investigations of choice. All these things are very important, and you should not enter the examination hall before brushing up these things. Okay, so this is for day 1. On day 2, the most important chapter of community medicine is contraceptives, and this is also given in gynae. So from wherever you have studied it well, study contraceptives. In biochemistry, study certain chapters like the enzyme chapter, because the group's classification of enzymes is very important. DNA, sometimes they ask questions from the DNA chapter, so you may brush it up because these are very factual things. That's why general biochemistry definitely you have to see, And heme metabolism is a chapter which, it is often not given much importance, but heme metabolism is a very important chapter because it is very small. Another topic on day 2 that I have kept for is hernia. And then from medicine, you can study acid base balance, especially the calculation portions. Okay, so this is for day 2. For day 3, in anesthesia, very important chapter is CPR, because we often neglect the CPR chapter, because whatever we learn by seeing people performing CPR, majority of the time it is not the correct literature written way of giving a CPR. We often, change the CPR method based on which situation we are in, and many people also do not know the exact methodology of giving a CPR. So first, it is very essential to know as a doctor. Second, if they ask you a question and you are not able to answer something related to CPR, it is going to be very shameful. So yes, I would suggest you to do CPR chapter, which is, I found, is a very important chapter from anesthesia. And anatomy, I know, is very, very vast, but I would like you to brush up general anatomy and general embryology. Even if you are not ready to go through the details, at least see all the images of general anatomy and general embryology. Okay, surgery, just once give a quick reading of specialty surgery, because it is a small chapter. They may not ask you, very conceptual, in-depth questions from there, but one-liners, and one-liners, you can answer well only if you have studied it in the last few days. Okay, and in pathology, I would like you to go through the images of pathology in lung, brain, and cardio chapters, especially the cancers. Okay, brain tumors, lung tumors. Okay, so for day 4, I have kept a lot of things, but these are very high yield according to me. So certain infections and chapters: hepatitis B, hepatitis C, TB, and non-TB mycobacterium, as well as HIV. Try to study as much as possible these things from pharmacology, from medicine, from microbiology. Okay, everything you must know about at least these infections: Hep B, Hep C, TB, HIV, and non-TB mycobacterium. Okay, very important. Pediatrics, do try to brush upon general pediatrics chapter. And another thing that I missed here is neonatology. This is also important. In comment, another very high yield chapter should be BMW, biomedical waste management. Very, very important. And in microbiology, disinfection. Because if you have worked as an intern in a hospital, these are certain things, biomedical waste management and disinfection, that the examiner will want you to know. Okay, and you must be answering these correctly, because the students who have worked very well as an intern, they know it by seeing it. In case you have not worked that much, these things might not have become, automatic within your system. So in these case, you have to read these chapters before you give the exam. Day 5th, let's study general pharmacology and autonomic nervous system, the two very important chapters of pharmacology. General pathology, again a very, very important chapter. And cancers from obs-gynae. Yeah, I know these cancers from obs-gynae is a little very deep, but I think they are high yield and you must be studying them. Another thing that I missed out is that you must be doing day 5th itself, you should be doing it. Chalo, let me write it. Physio. General physio and muscles. This also, I hope you should be able to do it in day 5, because this is also very important. Day 6, a lot more obs-gynae, very important. Labor protocols, what to be performed after what, at which time what protocol to be performed, very, very important. Certain very important pathologies like fibroid and endometriosis and other common pathologies that you will find while studying, do try to know the investigations that are done and their management. This is very important. Ortho, important thing that I think you should be knowing. The tumors of ortho, very important. And the fractures, then especially the named fractures of upper limb, lower limb, and spine. Just brush it up, okay? FSM, though not very frequently asked, but if asked and if you know and answer correctly, your rank will be a lot higher than those who have not answered it correctly. Is the chapter of identifications, number 1, and number 2, IPCs and CRPCs. But if you have not done or listed down the IPCs and CRPCs from your previous days of study, I think do not need to brainstorm a lot about the IPCs and CRPCs, especially the uncommon ones. But if you have already made a list of those, please try to brush them up, because if they come, if at all they come, and you are able to write mark it correctly, then to malamal ho jaoge, okay? In terms of ranks, I'm telling you. Right. So these are for day 5 and day 6. One thing I would like to tell you, everyone, that day 7th, I have not kept anything here. I would like you to customize your day 7th as you want, but still I have given a suggestion. But before that, day 1 to day 6, I have just given you what you need to study from your books. At the same time, you should keep on doing your Q banks, solving questions. So Q bank topics, I have made a list that you must be doing. Okay, for radiology, please try to do each and every image based questions that has been asked, and certain principles of procedures, like if there is a question asking you the principle of CT, principle of MR, principle of X-ray, okay, if there is a question like that, you should solve the questions. Okay, I'm not asking you to read very in depth for these topics, just try solving questions from these topics. Number 2, Dharma, solving the Q banks is very, very important, because majority of the times I've seen that they ask the repeats from previous years in Dharma. Okay, so someone who has solved the previous year questions for dermatology, at least they are going to be at an advantage. Okay, so anesthesia solve each and everything. If I tell about myself, I had not studied anesthesia as such from the book. Whatever I did was from Q banks. So if you are also like me and you have not studied anesthesia as such, solve every question in the Q bank. It will not take a lot of time, because the total questions in anesthesia is also less. In pediatrics, certain topics that you should be solving questions is growth and development. This is a very tricky chapter. Then the metabolic disorders, very important, pediatric heart diseases, congenital heart diseases, and the typical chest x-rays and the typical names of the surgical techniques for each. Solve questions based on those. Solve hematology questions from medicine, from pathology, from pharma. Hematology, I believe, is a very important question, and questions are asked from medicine, pathology, pharma, everywhere. FSM, I know, studying FSM, the rest of the chapters, just 1 or 2 days before the examination, many may feel it is a waste of time, because the net questions that are coming from FSM is very, very less. But at the same time, you should not be missing out on something that you have already studied, but you cannot remember at that moment, because you have not studied it recently. So to make an end to that, no need to study now, just solve questions from FSM. And that is also not going to take a lot of time, because FSM in itself, the syllabus is less. In eye, certain topics that you need to solve questions is from the lens, from the uvea and sclera. Biochemistry, glucose and lipids, we all know they are the OG. Solve questions. General pathology I kept for you to study also, and at the same time you should be solving questions also. General pathology is that important. In ortho, very important to look at the images of fractures and the images of tumors and try to differentiate the tumors. If you want, I can bring out a video on the orthopedic tumors and how to differentiate them. Okay. Next is CNS. Just as I told, hematology is a very important chapter. CNS is also a very important chapter. Doesn't matter where you are studying it from. Do all the questions of CNS from medicine and pharma. All the questions of renal from medicine and pharma. Anatomy, try to solve as much questions as possible, especially the ones which are image based, including histopathology images. Okay, I know anatomy is a very vast subject and it is not possible to solve each and every question of anatomy. Try to solve only the image based questions. Bring out all the textbooks that you have not been studying till now, after you cleared your MBBS, which are now covered in dust, and look at all the pictures of the instruments in gynecology, in general surgery and ENT. At the end of the book, they have given all the pictures of instruments, very, very important. PSM. I know PSM is very vast, not possible to study everything, Demography, single most important chapter from PSM along with contraceptives. Environment, the health programs are important, yes. Oh my god, hawa dicche. Okay, so the health programs are important, yes, but the most important health program I would say is anemia. So the dosage of iron and everything about the anemia programs you should be knowing. TB, HIV. And in surgery, along with trauma, solve MCQs of breast also, because breast is a very important chapter. Now, for the 7th day, certain things that I did, I'm telling you. Now, you can customize the 7th day based on your need. So, I studied my 20th notebook. I studied all my sticky notes. I already told you in my previous video that I had made flashcards on the cancer stagings. All those flashcards I had studied on the last day. Just go through all the classifications of the antimicrobial drugs and the classification of the anti-cancer drugs and the names of the drugs, okay? Just go through the classifications, because it is very vast though, so you might be forgetting. Mechanism of action, if you have studied till now, mechanism of action you will not forget. It is very conceptual, and if you are knowing the mechanism of action, you will not forget the actions, you will not forget the side effects. What you will tend to forget is the classification and the names of the drugs. Each drug is in which class, so that you should give a reading overview, okay? And then try to see the named classifications and the named scoring systems. If you had made a list of all the scoring systems or list of all the classifications till now, then it would be very easy. If you want me to name some of the named scoring systems, just wait, I'm bringing. So I have my 20th notebook. This was my 20th notebook. Okay. Yes, so I had made a list of all the important scores that I needed to revise. Number 1 was the obesity surgery theke obesity surgery mortality risk score. Garbi classification. Garbi classification is for what? Try to remember. Bosniak classification, Glasgow outcome score, then the Forest Rockall score, AIM 65 score, BIRADS, obviously, BIRADS, TIRADS, LIRADS, PIRADS. Try to remember, because these are much in talk right now. Then King College Hospital criteria, Manning's West Haven criteria for hepatic encephalopathy, Bismuth-Corlett score, cholangiocarcinoma, Bishop score in gynae, Tanner staging, Rees-Elsworth classification in ophthalmology, Mirrell score in orthopedic cancer, from cardiology, Bell score, okay, and then the gold COPD grading. Okay, so that's it from my side. You know, the last few days of the examination is less about how much you can study and more about retrospection. If it is very easy for you to revise in the last few days, you should be proud of yourself, because that means that you have utilized the time that you had for so long, okay, and you have studied the thing so many times that now revising in the last few days has become easy. But if things are appearing to be a little bit difficult for you now, you are trying to cramp up a lot of things, the best thing to do is do not try to overthink. Try to make a list of all the things that you are thinking is important now, and obviously all of this you will not be able to complete in these 7 days. So chalk out certain less important things and now make a schedule based on the more important things that you find out. And the last day before going to exam, please don't overstress yourself. Try to keep as less as possible topics in the last day. Okay, so that's what I wanted to tell you. Do not overthink. Overthinking is the worst thing, that we medical people have gifted to ourselves. Overthinking takes us nowhere. Instead, ponder that whatever you're thinking, is it realistic? Is it practical? Is it really going to happen? And even if it happens, is it really going to affect me? Try to use the time that you have in hand in the best possible manner without overstressing yourself, without making yourself feel like this is a punishment. All the best. Take care of yourselves. Meet you soon in my next video. Bye bye.